I think one of the most fun quotes that I remember is an early conversation I was having with one of the nurses. And when she started to understand what we were building together, she turned to me and said, "Wait, so you're saying I'm gonna get my own assistant?" Our AI operational assistants were created to give every member of the care team their own admin. We envision ultimately a world where every person in a health system can have an AI operational assistant that allows them to focus on the work that is most meaningful and value added and top of license for them, instead of spending time doing things that are below license, tedious administrative types of tasks. The realities of staff shortages, margin pressure, those aren't going to go away. And what that means is that we need to help use technology to create bandwidth in health systems to be able to help care for more patients. We need to be able to use this type of technology to support and up-level the work that each care team member is able to do. Our AI operational assistants are really the third generation of our technology platform. They weave generative AI into our core artificial intelligence, machine learning, and behavioral science platform to allow us to create these really amazing capabilities that include the ability to speak, to listen, to read, to write, to remember things, to take actions in real-world systems like electronic medical record systems and many other systems that our health system partners use. And what that means is that they really can act like an assistant that supports ultimately every role in the health system. And ultimately, I think we can drive multiple aims. We can help improve efficiency. We can increase the quality of care that we're helping provide patients by freeing up our care teams to be able to focus on the things that are top of license for them. And when you put all of these things together, I think we can transform the way that care operations is managed and conducted in health systems. Before our perioperative care coordination solution, typical pre-admission testing nurse's day might look like doing, of course, outreach to patients, spending time with a patient on the phone, usually assessing their medical history, understanding any potential risks as the patient's preparing to go under anesthesia, and providing education to the patient. That's the core of the work that they do. However, the reality is that for a nurse, typically that may be only 20 to 40% of the time that they spend per day is actually with the patient. Much of their time goes to administrative tasks that surround that phone call. That could be things like realizing that a fax was missed and processing a faxed medical record that needs to be placed into the chart. It could be following up with the patient after a call with an email that summarizes the discussion, make sure that all the instructions are relayed. It could be ordering missing labs. There are a whole host of different follow-ups and preparation activities that a nurse might have to engage in that almost always are administrative in nature. And so what we're really excited about is with our perioperative care coordination solution and the AI operational assistants that are supporting the nurses now, is we're allowing them to spend more time with the patient and allowing them to reach more patients and spend time with a broader segment of the population instead of spending as much time as they are currently on the administrative tasks that wrap around that phone call or that patient interaction. Our perioperative care coordination solution drives a truly incredible ROI on multiple dimensions that takes some of the trade-offs that health systems have had to make today. They either sacrifice on cancellations to increase productivity, or they might have to sacrifice productivity, but then they pay the price in cancellations. And so that balance is very hard to strike. We're sort of coming in there and removing that trade-off altogether. We can both help them be more productive and prevent more cancellations and optimize more patients all at the same time. Now, those are the key aspects of sort of the financial equation, if you will. But the benefits extend far beyond that too. overall, we're improving the quality of care, and you'll see that in quality metrics. We're also improving the patient experience and the staff experience. So when you really put this all together, it's an incredible opportunity to help our health system partners fulfill their mission, to help each of the people that are involved in this process, from the patient to the nurse to their manager to the leadership of the health system, achieve their goals and see value on every dimension.